People ask me every day, based on my decades of inside experience at Social Security Medicare, of helping hundreds of thousands of people out throughout the country. Once you have Medicare Part A and Part B, people ask me, what should I do now? And Medicare Advantage, Part C, Medicare Supplement, prescription drug plan, all the rest of it. What should I do? Ed, what would you do in your particular situation? What do you recommend to your friends and family? Well, there is no one decision. There is no one answer for everybody. If It depends on particular health. So let's say for me, even though I look like I'm 70, 75 years old, I'm actually only 58 years old. So I have a few years until I make the decision. But if I was going to make the decision today, I would look at my budget. And if I was able to afford a monthly premium, I would definitely choose a Medicare Plan N, as in Nancy, and then add the prescription drug plan as well, because the supplements don't come with prescription drugs. So I would do the Plan N. And why the Plan N? Well, it looks like it's going to be in the future. Now it's the premiums are cheaper for the most part throughout the country, and it's only a little bit different than Plan G. And But Plan G, I think it is more expensive now, and it looks like it's going to be more expensive in the future, and for not much difference in terms of benefits. So I personally, if I'm able to afford a monthly premium, then I would go with Plan N. My next choice, if my health, I needed, to go to the doctor more or something, I would do a Plan G. If I didn't have the budget, if something happened and I just can't afford a monthly premium, then I would go through a Medicare Advantage plan. What Medicare Advantage plan would I choose? It depends on what doctors I am seeing at that particular time. It depends on what prescriptions I have at that particular time. So I would go through the entire list and find someone. Hopefully, in my case, I would just find myself and enroll. But most people, if you get an agent or a broker to help you, it's the same exact price as if you went to the insurance company directly to enroll. So there's no added cost to getting someone to help you navigate the system. One of the benefits of having myself help you is my decades of experience inside Social Security and helping people with Social Security, Medicare, and disability. I also worked for Medicaid before that, and so I can help you with seeing if the state will help you with your Medicare Part B premium and your prescription drug plan and all the rest of it. So if I can find someone, if you can find someone that has the experience and insider knowledge and that can help you with Medicare and Social Security, your friends and family at no extra charge, that would be a beautiful thing. But for me personally, again, if I've got the budget, Plan N or Plan G. If I didn't have the budget, then go to a Medicare Advantage with a zero premium and look for the one with the least max out of pocket. And then if it's a Medicare Advantage plan, every single year in October when the new plans come out, I would shop around. It's not like, car insurance where I've got the same car company since I was like 18 years old. Um, Never changed it. But in terms of health insurance, even when I worked for the federal government, I changed my health insurance, probably once every couple of 3 years or so. I would do the same if I was on a Medicare Advantage plan. I would check in October and see if my plan still covers my doctors and my prescriptions. If it doesn't, I would look for another plan. If the prices went up in my current plan, I would look for another plan, see if I can get some more benefits. If I know I'm going to have some type of surgery the following year, I would, look for a plan that focuses on that. If I needed some dental work the following year, I would find a plan that has more dental work. And then once I got all my dental work done, I would go back to another plan that might be cheaper or something. So those are the variables. Definitely need to shop around, and it's always good to have an expert, and particularly an expert that doesn't charge you anything. and again, can be your resource for all things Social Security and Medicare, all the rest of it. There's one more trick of the trade too. If your budget doesn't allow you to get a Medicare supplement plan, again, 100, $130 a month or so, and then on top of that, a prescription drug plan for, 10, 15, 20, $30. If your budget doesn't allow that, and so you go the Medicare Advantage route with the zero premium, um, look at the plan, look at that particular plan and see what the hospital is going to cost you. Some of them, a Medicare Advantage plan for the first 5 days, might have to pay 200, 300, $350 or so for hospital stay. And there's other, cancer or some other type of issue that might end up costing you more. Um, so the trick of the trade is you can get what's called a hospital indemnity plan for just not very much a month. And that will cover what your Medicare Advantage plan doesn't cover. And you can also get what's called a rider to ride on that hospital indemnity plan of cancer insurance. If your family has a history of cancer or something, you might want to throw that on there before something happens. So you have a zero premium for your Medicare Advantage plan. Again, you're still paying your Part B premium, the $164.90 for 2023. You still have to pay that. But in terms of the Medicare Advantage plan, it's zero premium, but it doesn't cover everything. And you might be exposed to some hospital costs, or if you get cancer or something like that. So for usually, $20, $30, 40, under $50 a month, quite a bit under $50 a month, depending on what type of riders you add on there. You can get kind of like a Medicare supplement light plan in some respects, but not having to pay out, 125 plus, Part D. So that is one option, kind of a middle of the road option that you might want to consider adding as well. All right. So if you've got any questions, make sure you reach out to us and have a beautiful day.